In our cosmetic society, thick, beautiful hair is a prized possession, representing beauty, youth, and vitality. And when some of us begin to lose our hair, it can become traumatic and frustrating for men and women. According to recent statistics from the International Society of Hair Restoration Surgery, hair loss affects more than 35 million men and 21 million women in the United States alone. In fact, 40% of men have noticeable hair loss by the age of 35 and 65% by the age of 60. For years, popular treatment options included painful and obvious hair grafts and hair plugs, which often produced uneven results. But now new technology is offering more viable opportunities for patients looking for medically proven solutions for hair loss.
The questions about how much this procedure hurts or does it look natural or not, it really come from the fact that years ago they did. When I first started doing hair replacement surgeries about 20 years ago, we were actually transferring plugs. It was a much more painful process, the recovery was longer, and the end result, although we had more hair up there, didn't look very natural. The fact of the matter is, it became much more refined in the 90s. There was an explosion of new information and sharing of information with other hair physicians, and the techniques just became so much more refined, and that was the exciting part. Being able to introduce and transplant single hair follicles as opposed to a chunk of hair, or it's like laying sod, you know, it just doesn't look the same. So we were able to, at that point, be able to redistribute the hair in a way that was much more natural looking. Over the course of time, again, these techniques have become even more and more refined, so that it's just impossible to look at somebody and say, yes, you've had surgery done.
Dr. Niedbalski is one of the few hair transplant surgeons in the country that is a certified member of the American Board of Hair Restoration Surgeons and has served as Fellowship Director for Training for Hair Restoration Specialists. He is also one of the pioneering researchers in the application of A-cell with platelet-rich plasma for both hair multiplication and hair restoration surgery and combating baldness with injection therapy.
There's so many variables from one person to the next that will really dictate a very individualized treatment plan. The process of producing ultra-refined follicular unit hair transplants is all microscopic. We take the tissue that we remove from the donor area of the scalp, and under microscopes, the technicians in the operating room will individually create these grafts one at a time under intense magnification. And that's what allows us to be able to refine these to such a small degree. And then on the other side, making the incisions to the recipient sites to put the transplants into are also done under magnification with very, very tiny instruments. The incisions are really like little paper cuts, a little deeper, but not much, so they heal up without any visible scarring. Over the course of the next 2 to 3 months, little bits of hair will start to grow out, and it starts to become visible in the mirror to the patient at about 4 to 6 months. Some people a little sooner, some people a little bit later. And then it continues to improve over the course of an entire year. So at that 1-year follow-up, that's when we're looking at the final result, if you will, of the process. A-cell is a very exciting new therapy available in hair restoration surgery. It brings in the ability for your body to be able to reproduce new tissue. So in the case of doing a hair restoration surgery, that means the development of new follicles, which is unprecedented in this process. The bottom line is A-cell allows your body to be able to heal by producing new tissue, in this case new hair follicles, as opposed to scar tissue. So that brings in a thicker, fuller result at the end of the hair restoration process. We can move hair into any other area, onto the eyebrows, eyelashes, mustache, beards, and so forth, anywhere on the body. So that's a common procedure for us, is to do restoration in other areas. We also do a lot of repair work on patients who have had poor outcomes from surgeries in the past.
Dr. Niedbalski tailors a unique treatment plan for each patient, achieving a natural look and feel that can transform one's appearance and lifestyle.
I started looking at hair restoration when I was going through a real stressful time in my life, and I started noticing plugs of hair, falling out, and it started bothering me when I was looking in the mirror. So I did a lot of research, and I was very happy when I found Dr. Niedbalski. After talking to Dr. Niedbalski and explaining what he was going to do, how he was going to perform the procedure, and the improvements that he was going to make, I felt very comfortable, and I knew I was in the best hands. Best part about how I look and feel now is when I get up in the morning, I smile when I look in the mirror. I don't have to worry about my hair. It grows by itself. I can get it cut. When I walk out the door, I know I'm looking good, and everyone, they're always going to compliment me about how happy I am, and part of the reason for that is I don't have to worry about my hair.
One of the biggest surprises of the procedure to me was just how well the staff and Dr. Niedbalski explained it from the beginning to the end. It grows in very consistent, very level, and slow. And over a period of about 3 or 4 months, people start looking at you, and they do not know what you've done. They have no clue. And they're sitting there and just say, did you lose weight? You've been going to the gym? I feel like I'm 10 to 15 years younger than I looked before the procedure. Even the gym, just getting myself into the gym, working out, all that changed after I did my hair. So I actually feel younger.
An internationally recognized expert in hair restoration surgery, Dr. Niedbalski is also a leader in the education and training of new physicians in this emerging field.
I've been involved in educating other physicians for my entire medical career. It's difficult to do. It looks simple on the surface, but the one comment that I frequently get from plastic surgeons, cosmetic surgeons, and many other doctors who have done lots of other surgeries, the act of performing the surgery of a hair transplant is very technically difficult. It looks simple, but there's a lot of nuance to it. And that's the part that I think keeps me attached to the education portion.
Dr. Niedbalski is committed to keeping his practice at the forefront of the latest hair restoration technologies.
I want to make sure that I'm learning and understanding what are the new trends that are coming in and finding out what we can do to make sure that we're offering our patients the very best that's available to them. My job as the physician in these interactions is to educate them. I'm the educator. I'm not there to sell them anything. What I really love about my job is the interaction I have with my patients. It's so important to them what we're doing, and the fact that they're coming in and they trust us with restoring their hair and, in essence, their confidence. I had one patient tell me some years ago that it's like Christmas every morning when he looks at his hair in the mirror. It's just that sense of this is really something that's positive that's happening, instead of watching their hair falling out, they're watching it come back every day, which is really cool. It's technically very, very involved. It's microscopic. It's very precise. I really enjoy that. And it's also very aesthetic. So there's a creative process that's involved in this, because every head's different. We're not creating the same thing again and again. That really makes it very, very much a challenge, but really satisfying for me.
It's probably the best investment I've ever made besides my own children in my life, for myself. So don't wait, don't put it off, just go do it.
Dr. Niedbalski is wonderful. He's an artist, he's a sculptor, and his work is perfect. He has made an impact in my life. He has become a friend, and he's somebody that I will always have the confidence in, and if anybody needs to get this type of work done, he is the person to consult with, he is the person to see.
Hair transplantation and restoration has made great strides in recent years. Contact Northwest Hair Restoration for your free, comprehensive consultation and get the natural look you want and deserve. Call now to schedule your free hair loss consultation with Dr. Niedbalski and get back your hair and your self-confidence.